All right, we're talking now about your child and going either to an urgent care center versus the emergency room. What do you do as a parent, right?
Do you wait for a pediatrician?
Right.
Choices,
what do you do? Do you wait till the office opens? And joining us is our pediatric expert, Dr. Elizabeth Murray. She joins us in the studio with such great advice. And today you're here to talk about I guess what you do. I mean, is a parent's first reaction might be to what, panic when something is wrong? And then what you do, right?
Well, and that's a really important point because I think that people forget that if the thought of calling 911 crosses your mind, you have to remember you are now a distracted driver. And people don't think about that.
Okay.
And they think, well, you know what, maybe I was wrong. I don't want to bother 911. I hear that a lot. I don't want to bother the paramedics because maybe it's not that bad. And then you put yourself in a car with a child that's sick and you're worried about it and you're driving. And now everybody's at risk. So we take that very seriously, and people kind of laugh when we say that, but it's really a very important point, because imagine, child is in a rear-facing car seat having trouble breathing, you're trying to drive down the road, you can't see them, so we don't want to do that.
I just did that. I'm guilty of it myself about 2 months ago.
But people, you just don't think about it, because you're panicked, and you want to scoop your child up, and you want to go. But it's important to remember, especially in our area, you know, the days of ambulance drivers are long gone. We have a phenomenal group of pre-hospital care providers in our region that really, it's a mobile emergency department that comes to your door. So if something so bad is going on that you're thinking you need 911, then call. That's why they're there. However, you can take a beat, take a few seconds and look at a situation, and 10 seconds doesn't seem like that long, but if you really take a moment and look at what's going on and thinking, all right, is my child's breathing okay? There's not catastrophic bleeding coming from somewhere. You can kind of regroup and figure out what you need to do. The next thought process is, you know, how old is my child? We really don't recommend young children, especially infants and toddlers, be seen at urgent care facilities because they, in general, not always, but in general, they just don't have the expertise in that area.
Oh, okay.
Okay, that's good to know.
Yeah, so that would be a call to your pediatrician or a trip to the emergency department, depending on what's going on.
And I was surprised on our recent trip, I didn't realize the hospital that I went to, it had a pediatric ER. So there is sometimes that focus in ER too.
We are lucky in Rochester. We have 2 pediatric emergency departments, which is really great. And you mentioned trips, so there's actually an app made by the American Academy of Pediatrics, healthychildren.org. The Red Cross also has one as well, which will actually tell you where emergency departments and urgent cares are wherever you happen to be traveling at the time. So if you're out of town,
so you can
need
download the apps, and they can tell you no matter where you are.
It can give you some helpful information about where to go, which is really, really nice.
Healthy Kids, what?
Healthychildren.org is the website, and then there's an app that goes along with it.
I feel like, though, when, I mean, you know, Jen knows this better than most, but I mean, you decide, okay, do you, you know, how long do you wait to say, do you say, I'm sorry, here's what I'm trying to say. My point is this. At what point do you say, no, I'm going to wait till the doctor's office opens before I take the child to the ER, right?
Sure.
Like, at what point do you know, what are some of the symptoms parents need to calm down about and be like, no, let's wait till the doctor's office opens at 8 o'clock or 9 o'clock?
Fever, I was going to say, is the biggest one, probably. And I think that a good rule of thumb, even for the youngest children, is to say, all right, you know what, if I had the same symptoms, how would I be acting? And does it make sense with what I'm seeing? Because we're used to a 2 or 3-year-old running around and playing and being super active, and then they have a temperature of 102 and dish rag. You know, they're not doing anything. But in that situation, it makes sense. This is why the conversation with your pediatrician ahead of time about, based on my child's size, what's the right dose of ibuprofen or acetaminophen to give, so at 2 in the morning, when these things always happen, you're ready to go with the right medication. So having your kid at home with ibuprofen or acetaminophen, maybe some Benadryl, Band-Aids, and then, of course, any special medications your child might need if they have asthma or not. So, yeah, kind of figuring out, does it seem proportionate to what they're doing? If I had those symptoms, would I be doing the same? No, that's not your normal child. We know that they're normally running and playing and doing all that kind of stuff, but in the setting of illness, does it make sense? Then, of course, you've got cuts and broken bones. Those things need to be dealt with right away.
Okay, so many choices.
I know, well, that's the thing. I wonder, like,
which is a good thing.
What do you do? You
it's
say,
a good thing.
No, we're lucky. We have lots of options.
And think about, okay, what do I do? Think of the symptoms, and then make your choice.
And that's a good reminder. Everybody should take first aid classes. Everybody should take CPR. My dad used to work at the Red Cross. I made him refresh when my daughter was born.
I remember taking those classes.
That's why she's our expert. Thank you so much.
Thank you very much,
Pleasure to be here.